Okay, so when we say someone has anemia, what we're really saying is you just don't have a normal level of red blood cells that's required to carry the oxygen um, from your lungs to all your body tissues, right? So we could say you're anemic because your hematocrit is decreased, right? So that percentage in the test tube, the red blood cell percentage will be decreased. So low hematocrit. We could say you have a low hemoglobin level. That would be anemia as well. Okay. So, and typically they go hand in hand. If your hematocrit is low, then your hemoglobin is going to be low. Okay. And what are typical symptoms of anemia? Well, you have less oxygen carrying capacity. So, fatigue, weakness, you're dizzy because there's not enough oxygen getting to your brain. You're short of breath, okay, because you're trying to get more and more oxygen onto the red blood cells, but there's just not enough in the circulation, so you're short of breath. You can have chest pain because the heart's not getting enough oxygen because there's low hemoglobin in the bloodstream. So the heart responds with ischemic chest pain because of the low oxygen it's receiving. Okay? Okay, so I'll be repeating myself a bit on this slide, but I think repetition is very good when you're trying to learn new information. So, symptoms of anemia. So, classic symptoms are the ones we just went over, right? Fatigue, weakness, short of breath, chest pain because of the lack of oxygen going to the heart. You look pale, so pallor, right? So, and finally, the symptoms, the organs that are reliant on hemoglobin to carry oxygen to them are all going to give symptoms. So think of your lungs, think short of breath. Think of your heart, think chest pain. Think of your brain, think dizziness. Think of your muscles, think weakness and falls, right? So anemia presents with any of those symptoms. So how does the body compensate by the fact that you're just low on hemoglobin or your hematocrit is low? Well, the cardiovascular system can say, okay, I'll pump faster to increase cardiac output and try and maintain oxygen supply by just pumping more blood through the entire system. So a faster heart rate will do that. Okay. The respiratory system will breathe faster. You'll be tachypnic to try and get more and more oxygen so that as much oxygen is bound to the remaining hemoglobin that's in the bloodstream. Okay? And finally, erythropoietin will be stimulated by the bone marrow, by the lack of hemoglobin. It'll sense the fact that there's an overall low oxygen carrying capacity in the blood, and it will release erythropoietin to try and stimulate more red blood cell production. Okay, so we'll get into the different anemias, and hopefully it'll start to make more sense um, uh, what it means to be iron deficient anemia, what it means to be vitamin deficient anemia. So there's an assortment, and we'll get to them. Okay, so let's just look at this slide, and we've done some of these already. So we'll start at the top right. So your brain. So the sensation of fatigue and dizziness because of the lack of oxygen getting to the brain. If the anemia is severe and you have such little oxygen getting to the brain, fainting. Okay. If you're losing a lot of blood, say you're hemorrhaging from a car accident, well, your blood pressure is going to be low. Now, that's not going to occur if you're just losing a little bit of blood at a time, say from hemorrhoids or from some minor bleeding, because your bone marrow can compensate. So low blood pressure is typically you're losing a lot of blood quickly. Okay, what about the heart in terms of low hemoglobin or anemia? Well, it's going to beat faster, so rapid heart rate. Palpitations is the sensation that your heart's beating faster or it's beating irregularly. And then when you have very low hemoglobin levels, well, the heart's not getting enough oxygen, so chest pain. Angina is ischemic chest pain. And finally, if it gets bad enough, a heart attack, because the heart muscle has not received enough oxygen. The spleen, we're going to skip. Okay, that's only in a particular type of anemia. And let's go over to intestinal, we're going to skip right now. Okay, let's go to muscle, because we're trying to focus on the general symptoms of anemia. So, muscular weakness because of lack of oxygen getting to the muscles. The respiratory system we went over, the shortness of breath, because the lungs are sensing the fact that they have to breathe faster in order to try and get more oxygen into the bloodstream. The skin is often pale and cold. We'll skip the yellowing because that's a specific type of anemia. So we're just trying to focus on general symptoms of anemia. The yellowing of the eyes, again, that's a specific type of anemia. We're not going to do that here. Okay? Okay, so when we're classifying the different types of anemias, because anemias are caused by a variety of different conditions. So we need to classify it somehow. So on the left, we could classify it on what's on the cause, right? So blood loss, well, we could call that hemorrhagic anemia. I'm losing blood, and my bone marrow can't keep up with production, so I'm anemic because of that. Okay. What about the next one? Inadequate production of normal red blood cells. Well, if you remember that slide where you need vitamins, B12 and folate, you need proper amounts of amino acids to make the proteins, and you need iron. Well, if you're lacking any of those, you're not going to make normal red blood cells. Okay. What about excessive destruction of red blood cells? Well, there's certain conditions in the bloodstream that can cause the red blood cells to hemolyze, okay, meaning break down prematurely. And if red blood cells are breaking down prematurely, you can become anemic because the bone marrow can't keep up with the excessive destruction of the red blood cells. Okay? Let's look at it on the basis of what the red blood cells look like. Okay? Are they low in numbers, but they still look normal? That would be normocytic. Okay? So the red blood cells still look totally fine, but they're just low in numbers. Okay. Microcytic. Well, when we look under the microscope, not only are you low on blood, so you're anemic, but the red blood cells are small. They're tiny compared to normal. That's a microcytic anemia. And lastly, a macrocytic anemia, meaning you're anemic, but when we look at under the microscope, the red blood cells are large. And different conditions will lead to a macrocytic anemia, a microcytic anemia, and a normocytic anemia. So once we're able to break it down into categories, under each one of those categories, we'll have certain diseases that cause them. So it makes it much easier for us to find the underlying cause. Okay? And this will make sense when we start to discuss these individual types of anemias. Okay, so whenever you hear the word anemia, think, oh, low hemoglobin or low hematocrit, typically both. Okay, so the morphology of a red blood cell is just the size of the red blood cell. Okay, and that's going to help us um, do some detective work to see what is causing the anemia. Okay, so it's broken down into large red blood cells, macrocytic, small red blood cells, microcytic, and normal red blood cells, but low in numbers, normocytic. Okay. Um, Now, if your hemoglobin is low in your red blood cells, we call that normochromic or hypochromic. So a normochromic red blood cell will be filled with a normal amount of hemoglobin. So when we look at it under the microscope, it'll look normochromic. Chromic is just color, right? Hypochromic means when we look at the red blood cells under the microscope, they're they're not they're not filled with hemoglobin. They don't have a nice red color, so they're hypochromic. Okay, so let's do an example. Microcytic anemias are typically from iron deficiency. Okay, so iron is required to develop red blood cells. Okay, so the iron is required to make the hemoglobin. Um, it's necessary for it to attach onto the heme group. And if you're low on iron, well, the hemoglobin doesn't develop properly. And you end up with really tiny red blood cells. So we call it a microcytic anemia. Okay, what about a macrocytic anemia? Okay, anemia, we already know. Low hemoglobin, low hematocrit. Okay, macrocytic, those are large red blood cells. Okay, why are they large? Well, in order for red blood cells to mature to a normal red blood cell within the bone marrow, they go through stages of maturation and division. And B12 and folate are required for that maturation process. So if they're lacking, the red blood cells don't mature from those large precursor cells, the ones that are much larger before they become a normal red blood cell. So they remain macrocytic and large. Okay, so vitamin B12 and folate deficiencies cause macrocytic anemias. Okay, so let's just do a couple of examples here. So we do a blood test and we see someone is anemic, okay, low hemoglobin. Now let's go and look at the size of the red blood cell. Because remember, at the beginning of this module, I mentioned mean corpuscular volume. And that tells us the size of the red blood cells. Okay, if they're normal size, what kind of anemias are normal and have normal red blood cell size? Well, if you're losing lots of blood, the remaining blood is still going to look normal in size. The red blood cells will look normal in size, right? If you're breaking down red blood cells in your bloodstream for whatever condition, the ones that are still being produced are normal in size. Pregnancy. Well, pregnancy, you're still making normal red blood cells. You just tend to have a higher circulating blood volume, so you're anemic. Okay, I'm not talking about iron deficiency in pregnancy. I'm just talking about in general. When you're pregnant, you normally are a bit anemic because you have a higher overall plasma volume. Okay, chronic diseases. So anyone with a chronic disease such as rheumatoid arthritis or any other disease that is chronic, it affects the bone marrow and it just slows down the production of red blood cells, but it doesn't affect their size. So we call this anemia of chronic disease. So they're anemic, but they still have normal size red blood cells. So can you see how important it is to know the size of the red blood cell to then help you determine what's causing the anemia? Microcytic anemia we just spoke about. Little red blood cells, why? Because by far the most common cause, iron deficiency. You just didn't mature those hemoglobin molecules properly because you were lacking iron. There's a congenital condition called thalassemia that affects the globin proteins of the hemoglobin, and they don't form properly, and that causes small red blood cells as well. But iron deficiency, by far the most common for a microcytic anemia. Macrocytic or megaloblastic anemia, those are large red blood cells. What causes you to be anemic but have large red blood cells? B12 and folate deficiency will be by far the most common. Okay? There's other conditions like alcoholism. So alcoholics, the alcohol affects the bone marrow and it stops the maturation process a bit of the red blood cells, and they end up with large red blood cells. So if we see someone who's anemic and their red blood cells are large, okay, well that's really narrowed it down. It's either vitamin B12 or folate deficiency, or they have a liver problem, or they have alcoholism. So it really helps us narrow it down by looking at that MCV, the mean corpuscular volume, the size of the red blood cell. Okay, and here you go. This slide is just showing you at the top, what's the size of the red blood cell? Okay, is it less than 80? Oh, we call that microcytic. Okay, if it's microcytic, here are the causes of microcytic. Iron deficiency being by far the most common. Okay, is the anemia, so you have a low hemoglobin, but the red blood cells are normocytic, they're normal size. Okay, so chronic inflammation, chronic diseases, renal disease. Okay, so those diseases cause a normocytic anemia. And finally, large red blood cells, macrocytic, well, that's where the B12 deficiency, folate deficiency, myelodysplasia is a bone marrow precancerous condition where, because it's a precancerous condition, the red blood cells aren't maturing properly and they result in very large abnormal red blood cells. And finally, alcohol can give you a megaloblastic or a large red blood cell, but of course you're still anemic. Okay, megaloblastic or macrocytic anemia. Okay, so this slide I'm going to leave to you. So normocytic means the red blood cells are a normal size. Normochromic, they look a normal color under a microscope. But the patient is still anemic. Okay, so what could be causing that? Well, these are the causes, right? So overall, the red blood cells look normal in size. The hemoglobin content looks fine, normochromic, but there's just an insufficient number of red blood cells, and by definition, that is anemia. And these are the causes that can result in that, okay? And we've spoken about them already. So if you're hemorrhaging, well, the resulting red blood cells that are coming from your bone marrow still look fine, okay? Aplastic anemia is reduced bone marrow production of red blood cells and other cells, but we're talking about red blood cells here. And they still look fine, but there's just vastly reduced number, and that's why you're anemic. Hemolytic anemia, well, the red blood cells that are leaving the bone marrow look just fine, but they're being destroyed faster. Okay? So they still look fine, and oh, by the way, you have an increased reticulocyte count, but you're anemic because they're being destroyed so fast. And then finally, anemia of chronic disease, whichever chronic disease it is, rheumatoid arthritis, AIDS, a variety of chronic diseases make you anemic, and you're typically normocytic. Okay, so a normocytic anemia. Okay, so we've been talking about increased destruction of red blood cells um, within the bloodstream, say. And that's called hemolysis. So hemolysis is breakdown of red blood cells. So we haven't really mentioned, well, what can break down red blood cells so fast? Well, there could be increased physical trauma to the red blood cells. So say, for example, someone has a prosthetic valve in their heart. Well, that's not going to, when the red blood cells are flowing through that valve, they're going to be injured. That's not a natural valve. Okay, so that can lead to hemolysis. Very abnormal vessels can injure red blood cells. So say there's a lot of atherosclerosis and there's a lot of plaques in your vessels. That can lead to destruction of red blood cells. And there's a lot of conditions that can inflame blood vessels, and lead to damaged red blood cells. You can also have abnormal red blood cell production, meaning the red blood cells that were produced just don't change shape nicely like that picture that we saw above of a normal biconcave red blood cell. Some of them can sickle, such as in sickle cell disease. And when they do that, they don't fit through the capillaries very well, and they break up, they fragment. Okay? You can have an antibody reaction to a red blood cell, such as an incorrect blood transfusion. Well, that's going to lead to hemolysis and destruction of red blood cells. And you can also, believe it or not, have an autoimmune condition where your body is breaking down its own red blood cells. And that's going to also lead to hemolysis. Okay? And you can imagine, if your body is breaking down your own red blood cells, you're probably going to be anemic. Okay? Because your bone marrow won't be able to keep up with the production because so much is being destroyed. And finally, blood infections in sepsis. So sepsis is an infection in the bloodstream, typically from a bacteria, and there's so much inflammation going on in the bloodstream that the red blood cells start to be affected, and they start to break down and hemolyze themselves. Okay? So these are just examples of hemolysis.